beginning, and I will do share that presentation also. It's not more than 30 minutes. That is the one assurance I'm going to give you now. I hope you can able to see my screen. If you are not able to see, please let me know. Can you able to see? Yeah, if you can see, you can just text me. And by default, you cannot unmute by yourself, and some of you can do that. Okay, thank you. Thank you, Jain sir and Pratap. Thank you. And okay, so when you look at these today's presentation, you can see there are two terms are there. One is on self and another one is comparison. What do you mean by self? Anyone here, those who are participating, can you please give me your answer in the chat box? What do you mean by self? What do you mean by comparison? Anyone? Can you please try to give answer for the question? I think these are the terms we can hear many of the time in our life, I can say. And every day you may hear the term self-confidence, self-compassion, self-control, efficacy. There are many ways you can come to know that the self term, what it means. Okay, compassion means caring ourselves. Okay, lovely. Self means it's we. Okay, and same kindness to ourselves. Okay, I'm asking the different term. Self, you have to define me and define that compassion. Okay, self means individual. Okay, self means myself. Really good, really lovely. And linking me. Okay. And I think I accept that what you have said, that it is our perception, our understanding about the term self. Okay, just we will move on to that standard meaning for this. When you look at the standard, I can say, as per my knowledge, a standard dictionary or standard reference book can find out what you mean by self. Self is nothing but this is the thing that distinguishes ourselves from others. It is a one thing. It is an essential part of a person that distinguishes that person from others. Objects or other component that we can say generally is a self. And in psychology, also we use the term called self. What is here? It is a study of either cognitive, conative, and conative means the behavior and the affective representation of one's identity. Okay, if I say a particular person, you may have an idea that this person will think like that only, and this person will behave in that only. This person will express his emotions in a particular way. So these are the things we come to know that about the particular person. For example, Rajinikanth, what other thing comes in your mind? The speed and the style. So these are the self-identity. So that one's identity through it may be from the thought, from their behavior, from their emotions. If we can able to understand that, we can call it an self. And it is our subjective experiences. For example, every one of us here, those who are attending this webinar session, we have an idea about ourselves. So this is me. And you may have a positive or negative idea about yourself. That identity we call as a self. Okay, it comes from any one of the components. Just now move on to the second part of that title. It is about compassion. And as I said, compassion in Western perspective, I think the self is now, you cannot find that term here. It is a sympathy or pity or concern about suffering of someone else. I will give one example here. For example, when you see a dog in a street, someone is stoned that dog. When you look at that, you pity about, you are sympathetic about that instance. That is called compassion. It is about others, it is about other animals, it is about the nature, it is about that anything other person, that is on compassion. But when I added here self, it is on perspective, you can find it only in Indian perspective. You cannot get it, I can say Eastern perspective. Self-compassion, we can get it only from Eastern perspective. You cannot get these things from the Western perspective. And just I'll move on to that core title of my presentation. I'm going to make it in a two-part. And the first part is about defining the concept. Second part is about what are the benefits out of practicing self-compassion in our life. And finally, I will conclude my session with that. What are the simple strategies we can adopt? What are the simple strategies or technique we can use to develop our compassion? Okay. Self-compassion involves finding our healthy balance between self-acceptance and for self-improvement. It is about nothing but self-acceptance and self-improvement. Okay, accept who you are. It may be positive or negative. Accept as it is. And you are trying to improve that. Okay, you may have a certain level of ability. From that level to when you are trying to move to the next level, that is called self-compassion. These two are composition of self-compassion. And one more thing we have to understand here, self-compassion is, it's not about criticizing oneself for the mistake what we are making in our life. We are human beings, we do mistakes in our life. And self-compassion is, instead of criticizing, and it will accepting as it is and motivating the self to do better in the next time. And when you look at that in football match, and football or any kind of match, if there is someone, a player make a mistakes, first they will show a yellow card. That means warning sign. Then only red card. Likewise, self-compassion is not about criticizing ourselves. Okay, clearly. And next one is when you look at that most accepted one, I can say, self-compassion is an ability. Okay, it is an ability to turn that understanding, acceptance, and love inwards. Understand about yourself, accepting yourself, and love yourself. These are the three important components of self-compassion. Understanding. If I ask you, what are your strengths and weaknesses, I can say many of you here, you can able to say 80% maximum, I can say. Remaining 20% may not be known to you. Because many of us, we are not aware about who we are and what is the self we possess and what is the capacity it has, and we never aware about it. And when you come to that self-acceptance, most of the time when you ask yourself, are you accepting all the decisions, all the thought process comes in your mind? And finally, are you loving about yourself? There are many people, I can say that they are working for others, but they never give importance to the self. I hope you understand that. It is about self-understanding, self-acceptance, and self-love. And there is one of the researcher, I can say, Christian Neff, and I will share his presentation on that 361-page text, a book he wrote on that. I'll share that one also after my presentation, and you can use that. He found out, the researcher found out that it has three important dimensions or components. Self-compassion has three important components. One is self-kindness. Second one is common humanity. Third one is mindfulness. We'll see one by one. What are these dimensions? What are the components? What is self-kindness? As I said in the earlier, self-compassion, become aware about our negative self-talk and replacing with that the positive one, the gentle one, and in a polite manner, we say about ourselves. When you do mistakes, and then sometime we may say that you are an idiotic fellow, you have done something wrong. We will do that for someone very close to us. And the same thing we will do for ours when we do the mistakes. And self-kindness is something you have to replace that. Okay, you can't, instead of that, you can say that I can do that. I can do, it needed time. And the second component of self-compassion is common humanity. Common humanity is, I think we have to connect ourselves with others. Okay, acknowledge that someone is suffering for the person failure. Okay, I'm in failure. I failed in somewhere else. And someone is failed, and then someone is suffering, we acknowledge them. Okay, this person is suffering because he made an accident. How many times we are accepting, or how many times we are acknowledging that suffering we are making in our life? When we do the failure, I think most of the time we skip that. We just experiencing the pain alone, but we never acknowledge that. That is a common humanity. And it is an universal experience, and we need to have it. And final component and dimensions of self-compassion is mindfulness. Mindfulness, as you are aware about it, we are having 5 sense organs: eye, ear, nose, tongue, and then skin. These 5 organs, we have to do that one activity at a time. So focus on and do that only one thing about yourself. That is a mindfulness activity. So this also involves replacing the negative emotions into positive one. Okay. And I given that what other components are there in that self-compassion. Now I will just quickly run through that the benefit out of practicing self-compassion or having self-compassion in our life. So the first one is it increases our motivation, and many of them you can find out it is very difficult to push them to motivate themselves in academic in their personal life. But the person who has a self-compassion, they are having high level of self-motivation, and they will be more happier. It boosts self-compassion, boosts happiness, and we human beings are social animals. We are longing for happiness, and when we are do self-compassion, we'll be very happy because we will never blame about ourselves. We will never self-criticize ourselves for the mistakes. That itself help us to improve our happiness. And another thing, those are having self-compassion, that improves their body image, we can say self-image. And many people, they complain about, if my complex is white, I will be better. If I'm having that my nose is in sharpen, I will be good. So these were the yes, I think there are some of them are already giving that answer for me. It lowers that anxiety. I think we are going to discuss in my next slide also. And we complain about that what we are not having, but self-compassionate people accept it what they are having, and that will increase their self-image. It is another important quality. Most of the adolescents, they are not having, and we have to insist them to have that. And self-compassion enhances our self-worth, and they feel that, okay, this means I'm having that, I'm here for the purpose, I will do that. And self-compassion fosters the resilience in an individual. I think every human being, we are having setbacks or problem in our life. Most of them, sometimes we may fall down. And the people who are having the resilience skill, they will come back very quickly to the normalcy. It is another important quality we can see. And the person who practice self-compassion, they will be more resilient in nature. As I think there are Saraptik are already given the answer for me. I think she supported my presentation. Self-compassion reduces anxiety, stress, depression. And as you all know, that WHO said that India is the most depressed country. And when you practice self-compassion, when you inculcate that value of having the self-compassion, we may come down from that labeling that the most depressed country in future. And I think we all, not only us, I think the main purpose of we initiated this mental health webinar is to promote well-being. Okay, and when we do that self-compassion, it increase our well-being and wellness in an individual, as a community, as a family, as a society. And self-compassion improves our confidence. As I said, when you have the self-worth, when you have the better self-image, definitely that will increase our self-confidence, and it will motivate us to the better. If the self-confident people do better in their any kind of activities they take on, it may be an academic or work side. And the quality of life, when you look at that, there are many people complaining about what they are not having. And self-compassionate people they will okay, this is my body, this is my self, and I'm having that everything. I can improve my life. So it improves the quality of life because they satisfy what they have. And self-compassionate people are more successful. Their studies were proven that they found that among the successful people, whether they found there are many qualities. One of the research you can do that, it is an 8 minutes video. In that 8 minutes video, a researcher who has met and he conducted an interview with more than 40,000 people. 40,000 people, and he found that, and self-compassion is one of the trait he found that the successful people. See that interesting thing. And I think if you want to become successful, you must develop that self-compassion. And self-compassion people have more energy for doing activity. I think some of the youngsters now, and many people will say that even though they are having that physical energy, they will say that I'm lost my energy in any kind of activity. But we can find here the compassionate people have more energy in any kind of activities they are doing. And one more thing, by nature, I think we all know that when you are get into illness, it may be bacteria or virus, our body itself has a defense mechanism that will fight against that the problem already made. It will make a repair. When you practice or cultivate self-compassion in your life, it will repair the mistakes what you have done, including me. If I practice self-compassion, I may done a mistakes, and it will help us to repair that mistakes what I have done. And self-compassionate people will not engage in self-harm activities. I think the second leading cause of death in India, especially in Tamil Nadu, we are leading in suicidal rate, and it is see that self-harm will happen. It is one of the symptoms we can see. The self-compassionate people will not engage in these kind of activities, so it avoid. I can say, and they will take more responsibility, more personal responsibility in their life, and it may be an academic or related work. They take on thank you. They take on more responsibility, personal responsibility in their life. And another benefit out of practicing self-compassion is self-regard about themselves and others. When you have the high regards about yourself, definitely you will give the regards to others. And then these are important quality we can find benefit. And many people, they expect that the person not giving respect to me, and they are not having that any better opinion about me. These things we can, if we have the self-compassion, they will express, and they never disturb that, or they will not influence on others' image. And these are the people, as a self-confident, so that's why they fear less in their life. And in that fearless is a very common trait among that self-compassionate people. Self-compassionate people are suffer less from that excessive shame and social ideation. And these are the people, as I said earlier, they will not do the self-harm. It is one of the symptoms for social ideation. And here, these people less likely to suffer from that shame. Sometimes we may have a guilty feeling. When you do something wrong, you may have the guilty feeling, and these people will not have such a thing, and that will not make any further effect in their physical and emotional components. And self-compassion increases positive emotions like optimism. They are self-compassionate people. Mostly, they are more optimistic in nature, and they more kind to themselves as well as others. The people who practice self-compassion, kind people. I think we discussed earlier. Kindness. It is about one of the biggest wealth a person who can possess. It is not a material wealth. Kindness is another most important wealth a person who have, and the self-compassionate people are more kinder to themselves. Think about it. If I'm kind to myself, definitely I'll be kind to other people also. And self-compassion leads to less selfish behavior. I think selfish behavior of only everything they want only. Whatever the thing in front of them, they will think that everything we must have. It is only for me. And if it is unselfish, they may not have the better relationship. And there is a broken relationship. It is because they are not having the self-compassion. When you want to enhance a better relationship, and selfless behavior will be increased when you practice self-compassion. And self-compassionate people are better in emotional coping skills. And I can say most of the adolescent stage and female having that emotional problem, I can say they are very poor in, when compared to other people, and they are having that some extent of lower in that emotional coping skills. And if they practice self-compassion in their life, and they can increase indirectly in their emotional coping skills. And now I just pointed out that from the different studies carried out by different researchers, what are the benefit when we practice self-compassion. Now I'm going to state that what are the methods and techniques a person who can adapt. So I will take another not more than 5 to 10 minutes only. With that, I can stop my presentation. I give a space to you, and you can ask me, and we will interact with each other. What are the strategies we can adapt? And I can admit here, I found that there are 6 strategies only in a textbook, but when I went through that, there are 2 texts which were available in that net. And if it is possible, I'll do share that PDF, or else I'll share the link with you, and you can download by yourself. And it is an amazing. And I given that only that, and that what we can see, the title of that, for example, Badsha. I'm not giving that about the movie and what are the components are there. I'm going to give that Basha, and you can look at that when you want to further explore that, you can go there. And one is on practice guided meditation. And before saying that practice, I have to understand that most of the people who were insisting that mindfulness, okay, they want to distract, they want to think about only one thing in their life. And these people were insisting, I can say, Zen Buddhism, and as I said, Eastern philosophy, insisting this mindfulness. So for mindfulness, one of the important practices practicing guided meditation. What is guided meditation? I think when you see that guided meditation, guided imagery, so these were the things we can see. I'll give one example. When you listen, someone will direct you. They will ask you, I think we had a session with Dr. Subhasri ma'am. Ma'am asked you to close your eyes. And she given that, just you follow my words, what I'm saying. That when they were following, they will, okay, now you are in a place. You just imagine that somewhere experiences, you had a very blooming and you feel that more greenery. And that gives more happiness. You just imagine that. When we do that, these are the things called guiding the person who make them to come in a better way. So this is the first strategy, a person who can take for that self-compassion. And as I said, it is untitled only. There are in detailed thing, we can go to that and further and practice forgiveness. Forgiveness, there are many times we do a mistakes. Many times we do a mistakes and we forgive that other people, but we will not forget to forgive ourselves. And these are the second important strategy we can add up. Express gratitude. Gratitude. And I wonder that these things about happiness and other benefit I know, but I never aware about that. It is one of the important quality of self-compassion. Expressing gratitude. I thought that, I would like to admit here, I thought that I had a perception, it is that gratitude is something, when we receive help from somebody else, we are expressing our thank to the person. Thank you for the help which I have done. But actually, gratitude as another component, appreciating our good qualities. Appreciating our good qualities and recognizing what a good quality we possess. This one also one of the important component of gratitude. And thanking others comes second part. I wonder after going through understanding these things, and I realize that when you express gratitude to others and for good thing what you have done, that also develop your self-compassion. And another strategy is on employing growth mindset. I think there are two mindsets are there. One is on closed mindset and growth mindset. Growth mindset, think about that positive component. As I said earlier, what are the benefit? The person who has self-compassion, they have less negative emotions and they have more positive experience, emotional experience in their life. And here the growth mindset when we have, and these will develop the self-compassion. And they will change that, okay, don't you focus on that negative component. It doesn't mean that you never have any kind of negative emotions. We will have, and that is a reality. We have to accept that. But majority of the time, we try to have positive emotions in our life. And practicing right level of generosity. When you give everything, some people, they give everything what they have to others, like motherly figure. And they never think having. Here, what their self-compassion is, you have something, when you put something in that river, hold something what you need, and the other thing you have put it to others. When you are more generous to other people, keep something for you and give it to that remaining excessive thing to other people. Don't give the thing which is needed for you. So this is another practice. I wonder these things which were included in self-compassion. I thought it is a negative one, but when they were given the examples, there are many people, they are for others only, but they never think about themselves, and that will deteriorate that physical as well as mental health. And keep what are the things needed for you, and there is a circle you have to put it. The limit you have to fix it. It varies from person to person. I can say it is subjective. And mindfulness, as the first point, and this one point also, guided meditation and practicing mindfulness helps self-compassion a lot more. Because when we do that meditation, yoga, these were some of the practices which will guide them to one activity at a time. We are having different sense organs. Use these different sense organs for one activity at a time. Practicing mindfulness, that helps to love ourselves. And self-motivations. And as I said, the first benefit out of having the self-compassion is it increases our motivation level. And when we practice self-motivation, yes, we can do that. That means we are motivating ourselves, we are directing ourselves, okay, you failed this time, and next time definitely will come out from that. Instead of criticizing ourselves, when we are defining the self-compassion, we may know that it is not about self-criticizing, replacing that negative into positive. So practice self-motivating words, self-affirmations. And one important thing, one of the research they found that work with supportive people. And And when you not having the supportive people and supportive environment, definitely your self-compassion will be destroyed. And you just, your instinct will say that, your feeling or the energy will say that, okay, these are the people are good for you, you work along with them, and this environment is suitable. If your instinct saying that it is not good, don't break that and then continue it. And one day you will feel for that. And this is another practice you can make it. And explore, I would like to thank Dr. Srinivasan sir, he's a psychiatrist, and fortunately, I had a lot of similar thoughts, and we had a brief interaction also earlier, yesterday also. And he said that exploring self-compassionate or free expressive writing. What do you think about yourself? Write it about. And I think when you are fall in love, and then you can write a number of poems about your dream girl, dream boy. Why don't you write a letter to yourself? And free writing that will make you love about yours. Oh, I'm admire about your qualities. Write to yourself. And these things, this input I received from him. I personally thank the renowned psychiatrist Dr. Srinivasan sir for giving this point. And these points were already given in that one of the research finding also. And practice positive self-talk rather than negative one. As I said, no, the positive affirmation. And I'm going to give, there are few positive affirmations, what are the things we can use in our daily life for self-compassion. And for that, what you can do that, watch your words. What are the positive words you are using, utter in a day? Just find it out. And how many words you are speaking, and how many words are positive, and how many words are negative. And you can try to find out what is the equivalent word you can use it in the positive way. Not a complex task. Just watch them, or else record yourself for 1 hour speak, and you just speak about and record it and replay and find out how many negative words were given in a particular time period, and just note it down, and then you can think about yourself and how you can replace with that. I can't. I can, but it takes some more time. So this is the way you can replace it. So, and forgive about, there are many mistakes we will do, as I said. Forgive others, forgive about yourself. Yes, we human beings are, yeah, we will do mistakes. We are error. And forgive the mistakes what we have done. And spend time doing things. Sometime it may be anything. If you like eating, spend the quality time for that. If you are spending roaming, do that. When you are riding, do that. What are the things which you like? Spend some time for that. Not addictive one. Negative, not negative. Something. No, I like dope. I like drinks. I want to enjoy that. No, it's not about that. Some of the positive component, positive practices are there. I can say character strength and virtues. They are listed out. There are 24 character strength and virtues are there. You find out which one if that gives more enjoyment to you. Just do that, and try to avoid making judgments and assumptions about yourself and others. It's an important quality. And every time we make a judgment, no, I am not fit for that. I can't do that. We will make an hypothesis assumption. We will make it. No, it is very wrong. I can say this is another practice. Cultivate acceptance. Acceptance. I think self acceptance. Even there are flaws are there. When you do about yourself, when you are practicing it, accept it. Yes, it is my mistake. I will refine it. I will modify it next time. And pay attention to some. You may have the passion in some area. You just ask you about yourself, and if you are not able to get answer for that, ask your friends and family members. They will tell them this is your passion, and just take it and then just move forward. And one of the, as I said, now this is about research findings. I given one by different words. And there is one study, they given that 6 strategy, I can say, positive psychology. They are very good in that. They are from Denmark. They are working on with modules also. You can take a course also. They conducting course, a master course for self-compassion alone. And they pointed out there are 6 components. One is, most of the time we can see, for example, I am a person, someone is suffered. And the person suffering who will seek help from me. When someone is suffering, I will have more and more ideas. I will tell them, okay, don't worry, man. This is for a short span of time. If it is a night, definitely there will be a day. If you have the problem, and the next day morning, you will not have the problem. These are the way I will do them. Think about when you have the problem, have you say these kind of words to yourself? That is a point they are highlighting in their research finding. When you are having the problem, when you are in the conflict, when you are in some of the unwanted situations, just say about how you utter the word to your friend, the same thing you can do it by yourself. And what are the words you can say them? You can say to yourself. And there's a one thing, and you have to understand that what are the your self-talk. When your self-talk is something, when you do something, there are inner voices going in your mind. Inner voice will be there. You just watch out that whether it is on criticizing or motivating. If it is on criticizing, just realize that you are doing something wrong and then replace with that positive one. Pay attention to the words what we are uttering. And sometime you may love somebody else. No, okay. You may have very carefully used the words. You don't want to hurt the people, hurt the person, and use the word in a way. What are the words if you utter and they feel more happy? What are the words you speak? You try to speak those words to make them happy. The same words you can use for yourself when you do the self-talk. And comfort yourself with physical gestures. When you are that, motivate yourself. Who else will do that? Motivate yourself when you do something. Okay, yes, good man, you have done that. Just motivate yourself. That is a physical. I think Amikudi, there is one of the researchers. He said that when you fake your thing, I think I can say I'm not perfect in presentation. I can say when you look at my team members, especially Dr. Veena, Dr. Spacey, and other members, may aware about it. In the month of April, when we beginning this webinar session, I think about myself. I had many questions in my mind whether I can able to speak for welcome matters itself. I had a problem, but now I can say that these mental health webinar series made a huge impact in my personal presentation skill itself. I can say there are a lot of improvement. And when I was presenting, when I was exploring content, that one of the strategy Amikudi said that when you want to have that confidence, even in any kind of forum, sometimes my heart will be, I will get more anxious. I cannot do that. Now I can see there is an improvement in myself. There are something I'll do this kind of activities. Okay. So these are the things, some of the coaches, power coaches. Before presentation, 2 minutes only, just it has a huge impact. And one presentation I made with one of the, all the participants were vice chancellors, some of the administrative level people, I was presented what I found that a positive feedback for my session. I wonder, okay, so something is there. And I can say before that session, I practice these things. Self-physical gesture about, yes, we can do that, man. And if I'm not motivated, if I'm not compassionate about it, who else will do that? So this is another thing. I can say, I personally witnessed myself. I'm sharing my experience here. I'm the case study for you. And compassionate affirmations. I think we already self-talk, as I said, affirmations, using the words to others and ours. Replace the negative into positive. Even when you do NLP, go to that cognitive psychotherapy, what they are saying that cognitive restructuring, behavioral reformation, so behavioral modification, everything is saying that undesired to desired one. Okay, first you have to list out what are the undesired. If you know, then we can able to decide one. And if you know, if it is a particular behavior, particular thought, particular emotion is an undesired one, how you can replace with that desired one. And these are, we can say by affirmation, do that. When we practice it, it will come. Some of the affirmations I found, I accept the best and worst aspect of who I am. There are many words are there. And I wonder that the same point also we were discussing, the psychiatrist, Srinivasan sir, also same thing he said. When every day we have to practice in the group therapy, he insisted. And after his input only, I included this component. And practice guided meditation. In the beginning itself, I said, there are many trained people, so that I can say, Brahma Kumaris, they are having the Raj Yoga. There is one component, Raj Yoga, there they given that guided meditation, and the recorded thing will be that we have to follow it. And you feel that for even 30 minutes of a guided meditation, you feel more comfortable, more energized. And you love about yourself. And finally, this is a thing they said in their component, write a love letter to yourself. And if you have not done that, you can take a paper and pen, or you can take your mobile phone and write a letter to yourself. Hello, Mr. Suresh Kumar. I know you from these days. So I'm loving you because of these are some good quality. You write whatever thing you want to write it. Just write it and give it to yourself. And pack it and put it a postman also. And if you like to get it from the post, you can put it in a post box, wait for 1 or 2 days, receive it and then read. Okay. So these are the things we can do that. With that, I muted myself. I just conclude. And we talked about one of the, yes, sir. I think James are saying that I am receiving love letter from client. I can't do that. Counter transference. So, common barriers for self-compassion. For example, many of you may think about compassionate practices, but there are barriers. Are there? What are they? I think sometimes fusion with unworthiness. I am unworthy. I don't deserve kindness. These kind of words don't say to yourself. These are the barriers. Okay, whenever you have, just replace it. And anxiety, sadness, guilty, shame, these are the feelings when you experience. These are barriers for your self-compassion. And if you experience and try to get a supportive group. And for example, how this is going to help me? Pointlessness. And there are many people I can say that they may say that, okay, it's not useful for me. So these are the words they may use. And that also lack of personal experience and prejudice. And I can say that the quote Dalai Lama given here for someone to develop genuine compassion towards others. First, he or she must have the basis upon which to cultivate compassion, and that basis is the ability to connect to one's own feelings and to care for one's own welfare. Caring for others requires caring for oneself. Dalai Lama 14. He said, insisted, when you want to love others, when you want to compassionate to others, compassionate to yourself. Thank you all for being here and listening my presentation up to now. Thank you so much. I'm really happy to see many of you here. But when I was beginning the session, it was only 8 members. Now I can see 34 members. Really happy to see most of you all here. Thank you so much. Now I request Dr. Veena to take over that Q&A. I will make you co-host now. Thank you all. Yes, Dr. Veena,
yes.
you can.
Thank you so much, sir. I wouldn't say it was a session. It was like looking into your life and your personal experiences. You have put up the experience and the total journey of mental health webinar series 2020, how we have evolved through days. And also, like Louis has said, we have been criticizing ourselves for years and it hasn't worked. Try approving of yourselves and see what happens. So stop complaining and criticizing yourself and start self-compassion and see the wonders. Thank you so much for all the inputs you have given. I really like the love letter aspect because this stage of life, it's very difficult to get love letters. So probably we can write love letter for ourselves. And thank you. And participants, the forum is open for question and answers. So you could unmute yourself or put the questions in the chat box.
Dear participants, some of you may not unmute by yourself. You can just text unmute me, then I will enable you to unmute yourself. Yes. Anybody? Yes. Thank you.
Seems Jayan sir is getting a lot of letters from his clients. That's what he has put in the chat box. Lucky you, sir.
Yeah, just a minute, sir. I will make you 1 minute. 1 minute. I couldn't find his name. IJK. Okay. J. Sir, your name is there here, but I couldn't see in their name. Okay, now we can unmute yourself.
Yes, sir. Thank you, sir.
Welcome.
Yeah, when my studies, I am not getting the love letter. Now I am getting lot of, and I am passing to my wife.
Okay. Okay.
Not
Great.
in a secret, I am passing to my wife also.
Okay. Okay.
And recently, one lady is there. Her age is very less, 65 years.
No, lovely, lovely, lovely.
Only 65 years.
Only 65. That's great to have such a young, dynamic, lovely
Yeah,
person.
yeah.
Yes, sir.
When we are applying the mirror therapy daily, we can increase our self-esteem.
Yes, yes. Thank you.
And we have 5 sense organ plus 2 additional. One is self-awareness and self-balancing.
Mm.
If you are applying this also, we can know what is us.
Thank you. Thank you.
Okay, thank you, sir.
Sir, before someone shoots a question, I have a question for you.
Yeah.
How do you think self-compassion and compassion-based therapy are related? Do you think there is any relationship between both?
Yes, I think there are. When I was preparing, I can say when you in my presentation itself, I put it self-compassion 3.0. When I was doing the revision again, second time and third time, I found that there are a group of people who are working on this compassionate therapy. They are insisting we have to practice it for our betterment. I think, and there are one is the people, a set of people who are working for that illness and disorder to treatment of those components, and another set of people they are in a spiritual manner and positive psychologists. I can say, and some other people they are working here how to cultivate that positive quality in a person to prevent that expected problem in future. I think self-compassionate practices definitely help us to have a better wellness in our life. I hope I given the answer, like
Yes, sir. Sir, Kanaka Pratap wants
Yeah,
to ask.
Kanaga ma'am, I will unmute her. So just a minute. Ma'am, yes, you can unmute yourself now.
Thank you, sir. Thank you, ma'am. Sir, you have said that you have mentioned some strategies to practice to improve the self-compassion. In that, self-positive talk, that is self-mindfulness also the same thing, now, sir. Mindfulness is what is the difference between mindfulness and self-positive talk?
Ma'am, just a minute. 1 minute, ma'am. 1 minute. Yeah, okay. See, self-talk, as I said, no, there are three compositions are there. We have to one is an understanding, acceptance, and then motivation. Self-talk is about behavior, ma'am. So it is about behavior, and that behavior will be exhibited through the cognition component. And when we do the self-talk, it is our thought process only. When we change, that's why we can say in cognitive therapy, they are saying that cognitive restructuring. There, we can change our thought process. When you change the thought process, we will exhibit that behavior. We will use that appropriate words. So that is the meaning. I hope I given the answer, and I hope can you able to understand, ma'am, from that, or can I explain?
Yes, sir. Yes, sir.
Okay, ma'am.
Okay.
Yes.
Sir, yesterday I completed my 50th webinar.
Oh, great. Happy to understand.
Yeah, thank you, sir.
Great, sir.
Okay.
My appreciation from our team also.
Okay, thank you, sir.
Yes.
Congratulations, Jayan sir, for
Okay,
that 50th.
thank you.
Yes. And any more questions from the participants?
I think it was very clear. I think they understood. So we can go for vote of thanks.
Yes, sir. So
Yes.
now I call upon Subhashri ma'am to please place vote of thanks, and Shubha ma'am.
Hello. Yes.
Yes, ma'am.
Am I audible?
Yes, ma'am. Yeah.
Yes.
Thank you so much, Dr. Suresh, for a wonderful session on self-compassion. And we have been really immensely benefited out of the researches based on self-compassion. I would also like to state that the one particular sentence which I used to really, say it as a mantra is, day by day in every way, I'm growing better and better.
Yes.
I'm enough. I can do my best. So I choose to do my best is the one of the very important self-compassion statement you can always chant for any kind of situation. So I could write to restate over here. This has been done by a lot of people who have been seen that even if you take a medicine, if you say, even if you take any kind of an aspect you are working on, if you say this inside your mind, that really works wonders. And I have seen it as, and myself and Suresh as the example. We all are from a very humble background, from from villages we all are hailing from, and we all are from we have not had much of an exposure in early years of our education, but we make sure that we are internationally connected now, and we never had an problem or issue with regard to language or anything. That is only because of our will and the self compassion component. So we are ready to learn. We are ready to learn. It doesn't mean that we are arrogant on things. Very important is I am willing to accept myself with limitation is the one of the very important aspect, which Suresh has beautifully stated in his presentation. Thank you so much. Please accept our gratitude, and as well as retreating the importance of self compassion, because if you don't love yourself, there is a vacuum, and you actually respectfully love the other person also. You will be longing for love from other side, outside. So that could be actually found from even any therapeutic approach. Roger talks about this, the unconditional positive regard, and for the other person. And thank you so much. And from the Department of Psychology, Madurai American College, and as well as Madras School of Social Work, MS Challamuthu Rehabilitation Center and Trust, and also from Oncology Association Turkey, and as well as from our ICC, ICPP, also with all other associates. I'm really grateful, and our core team members are grateful for you, because every now and then you make sure that you bridge the gap if there is no one is available, and as well as we take turns. That is fine, but you come out with a beautiful presentation along with the content. That is the one of the very important aspect. So that's the secret we all have been waiting to learn from Suresh also. Thank you so much.
Thank you, ma'am.
Thank you so much, Shubha ma'am. And participants, kindly send your queries and feedback to mywebinarfeedback@gmail.com. Before we wind up, there is a question: how can I practice self-compassion from Sarabdeep Kaur?
Yeah, as I said, I will share that all the PDF files, but I'm having that, I will send it in the group.
I hope Sarabdeep Kaur, that makes your question. I mean, that's the answer for your question. So we will meet tomorrow with yet another wonderful session. Thank you. Good night. Bye-bye.